If you're dealing with neck pain, back pain, or constantly feeling tired and stiff, there's a good chance your posture is doing more damage than you realize. And the longer it goes unaddressed, the harder it is to reverse. But here's what most people don't think about. Bad posture isn't just a pain issue. It's one of the first things others notice about you, and they almost never say a word. After over 15 years in practice, helping thousands of patients recover from chronic pain and degenerative spinal conditions, I can tell you with certainty that much of the pain and fatigue people blame on aging or stress is actually driven by postural problems. And in many cases, they're completely correctable. In this video, I'll show you exactly what bad posture is doing to your health and walk you through a simple self-screening test so you can see the posture the way others do. And stay with me until the end, because I'm going to introduce a focused posture correcting routine that targets the most common problem I see every day in my patients, so you can start standing taller, looking more confident, and feeling better right away. Let's get started. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, poor posture, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. What others notice about your posture is not just whether you sit up straight. It's the overall signal your body sends about your health before you ever speak. When someone sees rounded shoulders, a forward head position, or a collapsed upper back, they're not thinking about your spinal alignment, but the brain is registering something. Energy level, stability, strain. Humans are biologically wired to assess movement, symmetry, and posture alignment as cues of health. The wiring lives deep in the nervous system. Your brain and inner ear constantly monitor balance and spatial orientation in you. And subconsciously, we do the same thing when we look at others. Humans evolved to stand upright on a very small base of support. That vertical posture is complex and energy efficient when it's aligned well. But when it's not, it looks unstable. Even if no one consciously says, that person has poor posture, they may sense fatigue, discomfort, or weakness. These impressions happen fast, and they occur across cultures. The same asymmetry, forward head posture, and collapsed chest that others subtly interpret as low energy are often the exact patterns driving neck pain, back pain, and that constant tired feeling you blame on stress or aging. I understand that everyone isn't going to have ideal posture. Posture is not about forcing yourself into some rigid, picture-perfect position. It's about balanced postural alignment that supports strength, efficiency, and long-term health. When that alignment deviates from normal, people notice. More importantly, your muscles, joints, discs, and spine begin absorbing stress they were never designed to handle. And that accumulated stress is where the deeper health consequences begin to show up. Take forward head posture, for example. For every inch that your head shifts forward, the load on your cervical spine increases significantly. Some reports say by 10 pounds per inch. What this means is that the muscles in your neck and upper back have to work overtime just to keep your head from dropping further. Over time, those overworked muscles become tight and irritated. This is where chronic neck pain begins. It's also why forward head posture is commonly linked to tension headaches, cervicogenic dizziness, and even tingling or numbness in the arms when nerves become compressed. Now, add rounded shoulders and a hunched upper back, often referred to as upper cross patterns. The chest muscles tighten. The muscles between your shoulder blades weaken and overstretch. The rib cage becomes compressed, which can reduce how efficiently you breathe. Instead of deep breathing, you shift into shallow upper chest breathing. At the same time, the lower back often compensates by overarching, creating strain that shows up as persistent back pain. A slouched sitting posture increases pressure inside the lumbar discs. Stay there for hours a day, and that pressure becomes repetitive stress. Shift your weight to one side consistently, and you create asymmetrical loading through the spine, hips, and sacroiliac joints. Subtle twists in the rib cage add more stress to the spine and the muscles. Individually, these changes feel minor, but they're repeated daily. They create micro-traumas that can accelerate degenerative spinal changes, joint irritation, disc injury, reduced mobility, and long-term fatigue that many people mistake for aging. The encouraging part is this: these patterns are visible, and if they're visible, they can be identified and improved. The easiest way to assess your posture at home is with two simple photos. Now remember, this self-screening test does not replace the role of a qualified health professional. If you have concerns about your posture, be sure to get checked by a health professional who focuses on postural assessments and corrections. To do this posture screening test at home, start by standing with your feet shoulder width apart and your arms relaxed at your sides. Take a couple of steps in place, then stop and stand in what feels normal and comfortable to you. Don't try to correct anything. This gets you standing in the most natural posture, which is what we want for an accurate assessment of what your current posture looks like. Now, have someone take a front photo. The phone camera should be level, positioned about mid-chest height, not angled up or down. Make sure your weight is evenly distributed between both feet, and then take the photo. Next, without changing anything, have them take a side photo. Again, the camera should be level at your mid-rib cage height. Stand naturally with your feet shoulder width apart. Once you have both photos, open the front view first. Imagine using a string to create a vertical line starting from the midpoint between your feet, running straight up through your body. That line should pass through the midpoint between your hips, through the top of your sternum, and at the base of your throat, and continue all the way through the midpoint between your eyes. Notice if your head is tilted or shifted or off center. Look to see if one shoulder is higher than the other. Check if your rib cage is shifted to one side or if your hips are shifted sideways. Now look at the side view. Draw a vertical reference line starting at your ankle and extending upward. Ideally, that line should pass near your knee, hip, shoulder, and ear. Notice if your head shifts forward away from the line. Are your shoulders rounded? Is your mid-back slouched or excessively extended? Are your hips pushed forward? What you're looking for are deviations away from the reference line, both from the front and side view. That line represents a general reference for ideal alignment, and consistent shift from it tells you about your abnormal posture. Now, in a moment, I'm going to show you how to begin correcting the most common posture problem most people have with simple exercises. But first, if you found any postural deviations in your photo, leave a comment and let us know which posture pattern stood out the most for you. And if you're getting value from this and don't want to miss upcoming videos focused on improving your posture, reducing pain, and preventing degenerative spinal conditions, make sure to subscribe to my channel. As promised, I'm going to walk you through 5 focused exercises to correct the most common presentation that occurs in humans. That's forward head posture. If that showed up in your side photo, go watch this video next and start fixing it today.